Welcome to the Liverpool Heart and Chest Hospital Mckinley device training video. Before we start, we need to locate the syringe driver and locate the syringe driver policy within the trust. Reasons for commencing a syringe driver should be discussed with both the medical team and the patient. So we're now going to run through setting up the syringe driver. You need to locate the syringe driver, and the equipment needed to set up includes the pump, which is available from the medical equipment library, a spare 9-volt battery, a BD Plastipack Luolox syringe, either 20mm size or 30mm size, and a butterfly needle, which is what is used in the clinical area, and the syringes and needles to prepare the medication and the prescribed medications. You need the drug additive label, the Sani wipe, a transparent dressing, a lockbox and a black pouch. The procedure prior to setting up. You need the correct prescription for the medications to be used, and the compatibility of the medicines should be checked. Verify the correct patient details, and the consent should be obtained prior to starting the infusion. Check the Mckinley device for signs of physical damage. Staff should follow the Trust Infection Control guidelines with regards to precautions and the aseptic technique and sharps disposal. We are now going on to preparing the syringe. You need to draw up the prescribed medications using the appropriate syringe with the appropriate volume immediately prior to use. In a 20mm syringe, there will be a maximum dose of 17ml, and in a 30ml syringe, the maximum volume is 20ml. A 50ml syringe can be used in special circumstances, but please contact the specialist respiratory team for further advice. Please note here that 15ml, including the diluent, is the recommended minimum volume. You then need to aseptically connect the infusion set to the syringe and prime the line. We're now going to move on to preloading the device. First, you need to check your battery is in place. You need to ensure the barrel clamp is down and press and hold the on-off key. The pump's identity and the 24-hour will appear on the display screen, followed by preloading, during which the actuator will begin to move. Whilst the actuator is moving, the self-test screen will be displayed, and this shows the pump's configuration. Wait until the actuator stops moving and load syringe will appear on the screen. Please note here that the actuator will always return to the position of the last programmed infusion, and you can use the forward and back keys here to alter the position for this syringe. Before loading the syringe, check the battery power. Press and hold the info key until the battery power is visible, and then press yes to confirm. Battery life lasts for 3 to 5 days of the infusion. Ensure here that the infusion line is not connected to the patient at this point. You next need to lift and turn the barrel clamp, and when you seat the syringe into the plunger, you have to ensure that the 3 points of contact are made. These 3 points of contact are 1. The plunger clamp, 2. The vertical syringe collar, and 3. The barrel clamp on the syringe. The load syringe display ceases when these 3 contact points are correct. The display will now show the programming of the infusion. The pump should recognise the size and brand of the syringe. BD Plastipack is usually the default choice. You need to check here that the details are correct and press yes to confirm. If the default does not appear as BD Plastipack on the display, you can scroll up and down on the up and down keys to select the correct size and brand of the syringe and press yes to confirm. The screen should now prompt start infusion. We're now going to explain how to sight the butterfly and connect the infusion line to the patient. You select an appropriate site. The anterior abdominal wall is the most common. In our trust we use the SAFT Intima device. This is the recommended device that the trust uses, and you need to follow the instructions for this device. You're now ready to start the infusion. Once the cannula is inserted and the pump is ready, press yes to start the infusion. The keypad lock should be routinely used to prevent tampering. To activate the keypad lock, press and hold the info key until the progress bar appears and has moved across the screen until a beep is heard. To deactivate the keypad lock, you just repeat the above procedure. The screen should now display the rate of infusion, the time remaining, and the selected syringe size and type. The small LED light will flash every 30 to 40 seconds, and the syringe size will alternate with pump delivering on the display. You secure the syringe pump in the plastic lock box and a black pouch if at risk of exposure to sunlight, and you complete the relevant documentation in the patient's electronic record. Key messages. It's important to protect the syringe from direct heat and sunlight, so you use the black pouch available. You need to disconnect the syringe from the patient before removing from the pump to avoid an inadvertent bolus of medication. Never add another medication to an already running infusion. You must prepare a new syringe. And once in progress, the rate must never be changed. The infusion must be monitored 4 hourly, and you must check the battery at commencement of infusion. The battery must be changed once it reaches 10%, and this can be performed during the infusion. Alarms and troubleshooting. When an alarm is activated, the light turns red and will display a message with instructions on how to rectify, and the infusion will stop. Before troubleshooting, press yes to acknowledge and silence the alarm. Alarms will sound if the syringe is completed, if the battery is depleted, if the syringe is displaced, or if there is an occlusion. When an alert is activated, the infusion continues and 2 to 3 beeps are heard every few minutes, and a screen message will intermittently display with the infusion running screen. The policy for this can be located on the intranet, and we hope that you'll be able to use both the policy and the video to enable you to successfully start up a Mckinley syringe driver.